All right, so I'm going to tell you what options our clients have for their medical care when they're pregnant. So in Saskatchewan, they can have, well, in actually most of North America and probably the world, they can have an obstetrician or a midwife or a family doctor. And these are people who catch their babies. In some very remote areas, there might be nurse practitioners, but anywhere where there's a significant population, those are the three options for people. So obstetricians are highly trained in disaster management and high risk. And in many parts of the world, people only have an obstetrician if they were high risk. They wouldn't go and have an obstetrician if they're healthy, normal, pregnant people, but here they do. So that's a little bit unusual when you look globally. Family doctors and midwives can work with people, if like, let's say licensed midwives and registered doctors and everything, they can work with normal, healthy pregnant women. And so if someone falls into a high risk category, then those two groups would refer to an obstetrician. So I think that's a really important distinction because a lot of people think midwives are less than. Midwives are actually the experts in normal birth, normal healthy birth and pregnancy. So a midwife would never refer to a family doctor. The midwives refer to obstetricians. The family doctors refer to obstetricians. So that's kind of how that hierarchy, if you will, when it comes to risk, that risk hierarchy works. Now, in most parts of North America, I would say probably almost all parts, people now see whoever's in the pool. So they might have their obstetrician and they see them on the schedule. And then when it's time to have their baby, they will get whatever obstetrician's on call working that day. And if they're with a family doctor, same thing. They get whatever family doctor is on call that day. And with midwives, there's a much higher chance they would have met their midwives because most midwifery practices are a small number of midwives. So they might meet 3 midwives and one of those 3 will be at their birth. Where we live, they might meet a family doctor and then one of 5 will be at their birth because they still have separate practices. If they're with the obstetricians here, they would have their obstetrician, and then when they're in labor, they have like a 1 in 17 chance of having that obstetrician. So that's kind of how that works. So most of our clients are going to be meeting new people when they're in labor, unfortunately. But there is a plus side. So in some areas, like I lived somewhere where it was a rural hospital and the doctors would come for their clients and they would stay until the baby was born. And we had a lot of cesareans at quarter to midnight. And I'm not saying people did that on purpose, but we're dealing with human beings who, I mean, maybe risk things look different at quarter to midnight than at 9 p.m. I don't know, just saying. Here, a lot of people are worried about getting rushed in birth. And what I see usually is that if people are taking their time, as long as there's some kind of progress, if their doctor's done their shift or their nurse or even their midwife, they get the next person and they don't get rushed into having their baby before shift change or before bedtime or something like that. So the downside is meeting new people in birth, and we know that how that affects hormones and everything. But the upside is that people get like a nice fresh face to look after them. So that's the bonus. Now we live in a province where people are really spread out, and all across Canada now, smaller hospitals, rural hospitals are not catching babies anymore. And I've had a lot of clients who, like, especially if they had a fast previous birth, are driving, 2, 3, even 4 hours in one case with someone I know, trying to get to the hospital when they're in labor. And meanwhile, they had their whole entire labor and baby in under 2 hours last time. So this takes a lot of planning. This is very stressful for people. And I've had a number of clients who, fortunately, they had the resources and the lifestyle that they could just rent an Airbnb or a little house for a month. They just came in at 36 weeks. And we used to see this all the time when I was working in Alberta as well. People would just rent a house and or some space and stay, and then they know they're close to their birthplace. They could have a home birth if they have midwives, a home away from home birth, I call those. But that is a reality in our province. And for some people, it's very stressful because they don't have the lifestyle or the resources to move into town for a month. And so I've seen people make some pretty hard decisions. They'll get induced early so they don't go into labor when they're at home hours away, or they'll come into town, get a hotel, and drink the castor oil cocktails until they're in labor. And so these people are making some pretty hard decisions. Now, if people have midwives, they can have a hospital birth or a home birth or a home away from home birth. Our midwives and most midwives won't travel too far out of town. There are guidelines and protocols and everything. And so a lot of people, if they're rural or if they just don't live in town, they will come to town when they're in labor. They might get a hotel, they might get an Airbnb, or they might have a hospital birth and meet their midwives there. A lot of people with midwives really want water birth, and it really depends on the area if people can have a water birth in the hospital. So I actually don't know of any places where someone could have a water birth in the hospital without a midwife. So like if they're with a doctor or a family doctor, an obstetrician, they will probably not be allowed to have a water birth in the hospital. If they're with a midwife, they might be able to have a water birth in the hospital, depending on the setup. Now, where we are, there's no water birth in the hospital, and that's a logistical thing because of drains and whatnot. So people may choose to have a home birth because they really want a home birth, or simply because they want a water birth, which is a great reason to have a home birth. And anywhere I've ever worked, people just get a blow up pool and set it up in their house. That's what we used to do in the hospital too. We would just have I mean, it's a proper birthing pool. It's really deep. There's a whole course, a water birth course in the doula training vault. And you learn all kinds of info about how deep the water has to be, all these considerations for water birth. But that's something to be aware of in your area where you're going to work. Can people have water birth in the hospital if they have a midwife? In some areas, like Moose Jaw down the road, the midwives don't work there. People cannot have a home birth or a water birth in Moose Jaw because that's just out of their area. So that's something that we navigate with our clients a lot, and we help them set up the pool. Sometimes we're doing things at the last minute. If they live here, we might go and help them set up the pool a couple of weeks ahead of time. If they don't have cats, I tell people, if you have a cat, do not set up your birth pool ahead of time, because, you know, cats, unless they have like a whole separate room where they can close the door and keep the cat out. But otherwise, we're coming in and setting up the pool when they're in labor, or maybe they're setting up the pool themselves. I offer my clients my water birth course so they can do that. But the pool takes about an hour to set up and about an hour to take down. So people are losing their support person or their doula or both while the pool gets taken care of. And that's why I love bringing new doulas to water births, because then it's like an exchange. The doula comes and does the work of the pool, and I'm there to help guide them if they need help. And they might take pictures during the birth or run around for little things we need. They're also in charge of maintaining the temperature of the pool. And that's a really awesome way for new doulas to get to be at a birth, and to be at a water birth, a home birth, is very nice. Hospital births, I've been to lots of very nice hospital births as well, but there's just a really different vibe with a home birth, and it's a really great experience. Now, if people are with midwives, family doctors, obstetricians, nurse practitioners, I work with a lot of rural clients who might have a nurse practitioner taking care of their prenatal appointments, but then at the time of birth, they will be expected to go into the city and have their baby in a hospital. By the way, this is a little aside, but in Canada, it is perfectly legal to have your baby anywhere you want, and you don't need to have a medical care provider present. So some people will do something called unassisted childbirth or family birth or free birth. Those are some of the names that get tossed about. And that basically means someone's choosing to have their baby without a medical care provider. Obviously, that would be a home birth or a home away from home or something. It wouldn't be a hospital birth. And that is perfectly a choice for them. No problem. Now, there is some legality involved in doulas or other people attending those births. That's a whole different topic. We're not going to talk about that today, but I'm just here to let you know sort of what people's options are. So anyway, let's say they're seeing a medical care provider, doesn't matter who it is, for prenatal appointments. Everyone who cares for pregnant maternity patients, they're making the same recommendations. So they will be offered, or depending who they're working with, if they're with a midwife, they'll be offered the gestational diabetes test around 28 weeks. If they're with some other medical care providers, they might be told, you have to do this at 26 weeks, 28 weeks. They don't have to. Everything is a choice. But I like to reassure people that they will get the same offers for ultrasound and blood tests and urine tests and all the same tests and diagnostics, no matter who they're working with. Some people are under the impression that if they work with a midwife or family doctor, they're getting care that's less than, and that's simply not true, because everybody follows the same obstetrical rules. And even in labor, all the healthcare providers, all the medical care providers have to follow the same guidelines. So they need to listen to the baby's heart rate on a certain schedule. And they're looking for all the same normals, all the same variations, no matter where someone's giving birth and no matter who the medical care provider is. It does happen that midwives are really known for the way they speak with clients about choice. And they're really good at that. They actually have more time built into their appointments to get to know their clients better and to have more in-depth conversations about things like testing and consent. So those are the people who provide the medical care for our clients. And a lot of people ask about that. And the other thing a lot of people get confused about is, what's the difference between a midwife and a doula? And so I just let them know that the midwife is a medical care provider. And in a nutshell, I tell them, you wouldn't trade your midwife for a family doctor. Like, you have either a midwife or a family doctor. And if there's a complication, then they refer you to an OB. And so that gives people a good idea. I also like to tell them midwives are experts in normal, healthy pregnancy and birth as well. And it happens that we live in an area where midwives do have hospital privileges. A lot of people think if they have a midwife, they're going to show up at their house with like a little sarong and a rattle and chant while they give birth or something, because that's what the media shows. Like, they don't understand how many years midwives study in depth for pregnancy, normal pregnancy and birth. That they are the experts in that. So those are some of the people. And then, of course, if we give birth in the hospital, or if we're with our clients in the hospital, they will also meet nurses, whether they're with midwives or with doctors, obstetricians. They will meet nurses along the way. They might meet administrators and all kinds of different people on the team in the hospital as well. And those people also all follow the same guidelines. So if you have more questions about that, feel free to get in touch.